What if you were told that over the second half of the 20th century, progress on treatments for diarrhea did as much to save lives as achieving world peace over the same period would have done? Hello, I'm Sumera Rashid and welcome to Vagabond bloggers. The numbers of death each year are due to diarrhea have fallen by 3 million over the last 4 decades due to advances like oral rehydration therapy. Meanwhile, all wars and political famines killed about 2 million people per year over the second half of the 20th century. Global health plays an increasingly crucial role in both global security and the security of the world's population. As the world and its economies become increasingly globalized, including extensive international travel and commerce, it is necessary to think about health in a global context. Rarely times goes by without a headline about the emergence or re-emergence of an infectious disease or other health threat somewhere in the world. This is alarming and raises serious questions of today's World Health statistic. Take for climate change and pollution. 9 out of 10 people breathe polluted air daily. In 2019, WHO considered pollution to be the most dangerous environmental health threat. Non-communicable diseases such as diabetes, cancer and heart diseases are collectively responsible for over 70% of all deaths worldwide, or about 41 million people in total. This includes 15 million people dying prematurely aged between 30 to 69. According to WHO, the world will face another influenza pandemic. The only thing we don't know is when it will hit and how severe it will be. Resistance to tuberculosis drugs is a formidable obstacle to fighting a disease that causes around 10 million people to fall ill and 1.6 million to die each year. In 2017, around 600,000 cases of tuberculosis were resistant to rifampicin, the most effective first-line drug, and 82% of these people had multi-drug resistant tuberculosis. So now, how to counter such threat is the biggest challenge. In 2014, the world was stunned by the Ebola outbreak in West Africa. Panic broke out all over the globe. Governments scrambled to contain the infection. By the time the last patient tested negative for the disease, the outbreak claimed thousands of lives and caused billions of dollars in economic losses. And the bitter truth is that we are still not much prepared for the next epidemic to hit. What the world needs and what our safety, if not survival, demands is a coordinated global approach. Specifically, we need better tools, an early detection system and a global response system. Logically speaking, I'm not a scientist or a doctor, but what I think is eradicating chances of next epidemic needs participation from us all. Now you must be wondering what you can do in this. Of course, well, frankly speaking, you can educate yourself on this issue. You can learn about several diseases and symptoms. So if a condition occurs, you know what to do. And if not these, you can certainly help in spreading awareness, educating the illiterate. The contribution you can do is in improvising the local hygiene and sanitation. Like most of the health issues primarily originate from unhygienic conditions, you have the power to stop them. At the very least, the world needs helping hand, and together this catastrophic risk can be fought easily. Not to leave this out, world is working incredibly awesome in improving global healthcare system. Thanks to better immunization and other intervention, child mortality has been reduced by more than 50% since 1990. We are on the verge of eradicating polio. HIV is no longer a certain death sentence, and half of the world is now malaria free. But we still have a long way to go. We still have areas to work upon, and we still have risk for future outbreaks. Remember, what the world needs right now is the participation from us all. Together, we can fight this. Share your views about the same in the comment section below, and don't forget to like and subscribe our channel. Thank you.